So I have completed my screening and my full purpose T assessment. So I'm going to go on to the next step. Only click here when you have completed and signed the form above. So I'm going to click in the box and it says go to step B, treatment options to the right of the screen to order the power plan. Now, as you can see in this case, I have been suggested a power plan amber, but actually it looks like the documentation we put on the record is in between a green or an amber. So it's down to our clinical judgment to what we're going to pick. However, it says consider the risk profile, risk factors present to decide whether you're happy with a green or an amber pathway. So document in the pressure ulcer risk factors power form. So we're going to go back onto the left-hand side, go to step 3A and click here to document the risk factors to be taken under consideration. So I'm going to click on that blue link. And as you can see, down the left-hand side, this matches the ASKIN framework. So looking at the risks of skin damage and pressure damage. So we're going to go through this one by one and see if it's applicable for our patients. So the first component is skin, and it has much more detail of conditions that can affect skin, as you can see, but I'm going to click on non-applicable. Now, also you can see in these boxes as well, you can actually tick more than one option. So I'm going to move on to surface. And as I can see here, this is where you can document as your patient got an air mattress or cushion at home, a medical device in situ that could cause pressure damage or shear, or it already has done. If they've got any orthopedic devices in situ, which obviously limit mobility, or have they had a long lie on the floor before they've been in the hospital? Our patient hasn't got any of these, so I'm going to click on non-applicable. And then we're down to keep moving. And again, it goes into the patient's mobility in more detail. And I'm going to click on non-applicable for this. And then incontinence or moisture. Okay, so again, this comes into a little bit more detail into what the moisture is. And I'm going to click on non-applicable. Our patient hasn't got a problem there. And then nutrition and hydration. Not applicable. I'm going to click non-applicable, but again, you can tick any of and many or as little as these boxes as you want. Now I'm happy that I've got no risk factors there from the ASKIN framework. So I'm going to click on the blue tick. And from that, I'm going to pick, in my clinical judgment, the green pathway. But again, every patient is an individual, so you would pick whatever is going to be match your patient's risk for pressure and skin. So I'm going to click on the green pathway and then order as usual.